Over the last 26 years of teaching clinical and business topics and ethics, the question I get asked all the time is, how do I grow my practice? My practice is slow, it's sluggish, it's not thriving, maybe struggling, maybe not making ends meet, maybe having to have a side job to make ends meet, pay the bills. What do I do to grow my practice? And what I point out is that the main issue practitioners have is not getting new patients, because that's usually the question the practitioners ask. They assume the problem is, I need more patients, I need more patients, I need more patients. And that's rarely the case, sometimes, but usually not the case. The main issue with practices that are not thriving and abundant is poor patient retention. In other words, not being able to work with people over a long term. So there's several layers to this, but one of the key things that encourages patients working with you for an extended cycle of healing and then beyond is understanding the 3 phases of care. And this is for you to understand, but also to explain to your patients. And so let's look at this. This is a little picture that I draw for patients, this little diagram I draw for patients, very simple, of the 3 phases of care. So this is 3 phases of care. So the first phase is the acute phase. So this is phase 1. This is the acute phase. And this is usually, there's something urgent, a crisis, pain, something like that brought them in bad shape. Now, some folks come in when things aren't that bad, that's preferable, but sometimes they come in there in a bad way. And so this is what I call, you can abbreviate this, putting the fire out. PTFO, putting the fire out, is what's involved with that. Put the fire out. And this phase of care can last anywhere from 2 to 8 weeks, typically 2 to 8 weeks, and the patient should be out of trouble. The second phase of care, very important, is the corrective phase. The corrective phase of care is what differentiates a holistic practitioner. It is very specifically what I call RCR, root cause resolution. Root cause resolution is what makes a practitioner holistic. You're not just chasing symptoms, but you're actually looking at root causes, upstream causes, not just symptoms downstream. And this phase can take anywhere from 6 to 24 months to do root cause resolution. I'll tell them that. I had a patient recently, he's had psoriasis for 30 years. I'm like, well, you got to give it 1 to 3 months of treatment for every year the condition has been there. So 30 years of a condition, it's going to be 30 to 60 months to resolve it, maybe even 90 months to resolve it. It won't take 30 years to heal, but it does take some time. And this is the corrective phase, addressing root causes, underlying problems, underlying imbalances, deficiencies, and then, walking through various phases of care like, purification, for example, or detoxification. And then, this is really important, is the wellness phase of care. And this is prevention and maintenance, PM. And this is, as long as they want to be with you. So I'm just going to put a little infinity sign there, and it's as long as they want to work with you. So I'll explain to the patient these 3 phases of care, and that way they know that they don't just, as soon as they start to feel better in the acute phase of care, doesn't mean they should leave, because we haven't even gotten to addressing why they got into rough shape to begin with. So this is very, very important. And then we encourage people to just, do occasional wellness care, right? Could be once a month, every 2 months, even every 3 months of like a tune-up treatment, and then some supportive long-term supplementation preventatively. So this is the 3 phases of care. I have as an example, we had a student in my 1-year certification program in natural functional medicine, the Clinicians Mastermind Circle, and she had joined the program and was talking to her about her goals. And she was really struggling in practice. It was really hard for her. She actually had to have a side job teaching physiology and anatomy at a local community college because her practice just wasn't paying the bills. And she's a fabulous practitioner. I asked her about, she's a chiropractor, practicing 20 years, really, senior, very effective, very great practitioner. And it turns out that she was just doing acute care. Because I said, well, how long do you work with people for? She said, well, people come to me for structural problems. They're in pain. They have some other structural issue. And typically, I completely resolve it in 1 to 2 treatments, and I don't see them anymore. I was like, well, there's the problem. All you did was sort out the acute issues. You didn't get to corrective care, and certainly nowhere near doing wellness care. And so she was all stressed out because I asked her, I said, well, let me guess, you have to work really hard to bring in new patients all the time. She said, of course, I only work with people for a couple of visits, maybe 3 at most, because I'm really good at doing structural care and I just resolve whatever it is. And so long story short, through the course of the program, within 9 months of joining the program, a couple of things happened. One was she started doing corrective care, and then she started getting into wellness care as well within those first 9 months. And educating your patients in this model, drew this little diagram, explained to them how the course of care works, and that as they go along, they need less treatment, they need less frequent visits, they need fewer supplements. Everything, dials down as they get to wellness or preventative maintenance care. But it's better to stay well than to get well. That's what the maintenance phase, the wellness phase is all about, is about staying well so you don't get sick to begin with. It's better to prevent than treat. Easier and cheaper, simpler to prevent than treat. And happily, her practice revenues tripled in 9 months. She'd been practicing for 20 years, so she wasn't a new practitioner. Well, you'll see that initial burst of growth in the first couple of years because you're just starting out. You don't have any patients to begin with. She had a mature practice, but was still really struggling. So gross revenues tripled in 9 months. She was able to quit her job, her side job, teaching, anatomy and physiology at local community college. And she just really loved the experience of working with people over a longer period of time, getting to know them, getting to know their lives and what's happening with them in their lives. She was just more happy and satisfied and fulfilled in her practice. She's having more fun, more benefit beyond just acute symptom resolution. And and obviously her practice is much more abundant and financially prosperous. She never made that much money before. Her revenues tripled, highest it had ever been by far. And everything was just great. And it all got down to understanding and implementing and conceptualizing and planning for and educating about the 3 phases of care. So your next step is to get clear about that and start teaching that to all of your patients and teach them where they are in the 3 stages of care. Maybe they're in the acute phase and we need more treatment, more aggressive protocols, all of that, because you're in a bad way. Maybe they're in the corrective phase. Now we're unpacking underlying causes in the liver and the gut and the immune system and chronic infections, whatever it is, chronic inflammation. And then maybe they're in the wellness phase where they just come in for tune-ups occasionally and are on a basic, supportive protocol of supplementation, and then maybe an annual cleanse or annual purification program. So those are your next steps to really land in your practice the 3 phases of care. Thanks for listening, and a whole lot more that you can learn at michaelgaeta.com. Thanks for listening.